Extract 1. Questions 1 to 12. You hear a podiatrist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. What brings you in today?
Good morning, doctor. Well, it's my left foot, primarily. It's been a persistent nuisance, honestly.
Could you please elaborate?
Sure, it started subtly. A dull ache just behind the ball of my foot, almost radiating into my second and third toes. That was, probably 6-7 weeks ago now. Initially, I just thought I'd overdone it. A bit too much walking on a particularly long weekend trip. I'm usually quite active. Lots of walking, some casual cycling, a bit of badminton with friends, nothing extreme. But this feels different.
And how has it progressed since then?
That's the thing. It's not just a dull ache anymore. It's become sharper, especially when I push off that foot, like when I'm climbing stairs, or even just standing up after sitting for a while. Sometimes, it's like a jolt, a sharp, almost burning sensation right in the metatarsal heads. And the tenderness. If I press underneath, between my second and third toes, it's exquisite pain. I've even noticed a sort of tingling and almost pins and needles feeling in those two toes, particularly after I've been on my feet for an extended period. It's not constant, mind you, but frequent enough to be concerning. And it's worse in certain shoes. Anything with a bit of a heel, even a low one, makes it considerably more uncomfortable.
Mihiraa, have you tried any remedies at home?
Oh, absolutely. My initial thought was just inflammation, so I've been religiously applying ice packs for 15 to 20 minutes, a few times a day. I've also been taking over-the-counter ibuprofen, about 400 milligrams, twice a day, especially on days when the pain flares up. That seems to dull the edge slightly, but it's definitely not a cure. I also tried resting it more, cutting back on my walks, but the moment I resume any normal activity, even just extended standing, it's back. I even bought some gel inserts for my shoes, thinking it might be a lack of cushioning, but they haven't made a significant difference.
Based on what you're describing, Mihiraa, it strongly suggests Morton's neuroma. This is a common condition, especially among active individuals, where the tissue around the nerves leading to your toes thickens. It's often exacerbated by activities that put pressure on the forefoot, like running, or even prolonged walking in restrictive footwear. Given your history with badminton, it's plausible that it could be linked to repetitive impact or pivoting.
Oh, is it? What's next then?
For treatment, we'll start conservatively. Mihiraa, I recommend custom orthotic inserts to help redistribute the pressure on your forefoot and alleviate the nerve compression. I'd like you to continue with the RICE therapy needed. We'll also incorporate some specific stretching exercises for your calf muscles, as tightness there can sometimes contribute. I'll give you a handout with detailed instructions for these. And do you have any questions about the steps?
Oh, is it? What's next then?
Mihiraa, if after 4 to 6 weeks of these measures, there isn't a significant improvement, we might consider a corticosteroid injection to reduce inflammation around the nerve.
Okay, 6 weeks. Got it. Thank you, doctor. This has been very helpful. You hear a physician talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Hi, Mihiraa. Come in and have a seat. Can you tell me a little bit about what brings you in today?
There's this bump on my forehead. It's been there for a few months and it's just getting bigger and bigger. I hate it.
I understand. Can you describe about it a little more? Is it painful or tender?
Not really, it just feels weird sometimes. But it's awful to look at. It makes me so self-conscious. I don't even want to go out anymore. It's horrible, Dr. Patel. Everyone stares, and I can't even wear makeup because it just makes it look worse.
Let's take a look. It does appear to be a cyst. Have you noticed any changes in it over the past few months?
Just that it's getting bigger. Is there something you can give me to make it go away?
We have a few options. This can sometimes be cleared up with warm compresses or medication, but in your case, it might be best to remove it surgically. It's a simple procedure and wouldn't leave much of a scar.
But what if it leaves a mark? I can't have anything else on my face.
I understand this is stressful, Mihiraa. These are usually benign, and the surgery is very routine. Scars are minimal, and we can discuss options to minimize them further. However, leaving it could cause discomfort or even infection.
I don't know. Can't we try something else first?
We can explore other options, but there's a good chance surgery will be the most effective solution. Would you like me to explain the procedure further, or perhaps some resources about epidermoid cysts? Knowledge can sometimes help ease anxiety.
Maybe. It's just, I've been feeling so down lately because of this.
It's completely understandable to feel self-conscious. Honestly, Mihiraa, talking about these feelings can be helpful. Would you be open to discussing this with a counselor? They can help you manage the emotional impact of this situation.
Doctor, I don't know.
It's completely normal to seek help when you're feeling overwhelmed. We can discuss some options together, and of course, the decision is entirely up to you. Right now, let's focus on getting you the best treatment for this condition.
Okay, surgery sounds scary, but maybe it is the best option. If it means this thing will finally be gone.
That's a very positive step, Mihiraa. The surgery itself is quite quick, and most patients recover well within a week or two. We'll schedule some preoperative tests just to be safe, and of course, the nurses will walk you through everything before and after the procedure.
What? More appointments?
Just some routine checks to make sure you're healthy for surgery. It's nothing to worry about, but it helps ensure everything goes smoothly.
You mentioned a therapist too. I never thought about it, but maybe I could use someone to talk to. I just feel so ugly because of this bump.
That's completely understandable, Mihiraa. Many people feel self-conscious about changes in their appearance. A therapist can help you develop coping mechanisms to restore your confidence. It's not about changing how you look, but rather how you feel about yourself despite it.
Yes, please. Maybe talking to someone will help me feel better about myself, even with this bump, or even after surgery.
That's a great decision, Mihiraa. Together, we can get you feeling better physically and emotionally.